have some folks who might be joining us in just a few minutes here, but we are so excited to have you all with us today. So welcome. My name is Kim Barnes. I'm the Director of Student Affairs for our Phoenix campus in the College of Public Health. And we're so excited that you're joining us today for the Fall 2023 Virtual MPH Applied Practice Conference live event. And we're so excited to have with us today current students, faculty, preceptors, and prospective students. So we'd like to take a moment to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. So as many of you may know, our Master of Public Health students come from Tucson, Phoenix, online, and global campuses, and all of these students conduct applied practice experiences in communities around the world. These experiences serve as an integral part of the MPH degree curriculum, in which our students are able to utilize their academic knowledge from the classroom in real-world practical situations with professionals in the public health workforce. These hands-on culminating experiences benefit students and organizations alike. We're so profoundly grateful for the collaborations between our students, faculty, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. This virtual Applied Practice Experience Conference is our opportunity to showcase the breadth and depth of public health work that our MPH students have done with local, national, and global communities. Coming up next, you'll get to meet two of our MPH students and Fall 2023 presenters, Megan Corr and Carly Erickson, and learn more about their amazing experiences. After our student panel, we'll provide some additional details about how the conference and how to view our fantastic student presentation. A couple of housekeeping notes, as usual. This is meant to be sort of a more informal discussion with these two students. So if you have questions while we're having our discussion, please raise your hand. Then you can unmute and ask your question, or you can certainly use the chat if you're more comfortable in that environment. So I'm going to welcome our student guests today, Megan Corr and Carly Erickson. I'm going to give a brief introduction of our two student speakers, and then we'll have some prepared questions. Then we'll open it up to the audience. But again, if something I've asked or something one of the presenters has shared sparks your interest and you have a question that makes sense to ask right then, please feel free to do so. We're going until 5 o'clock today if we have questions and engagement from our audience, which we certainly hope we do. So our first speaker, Megan Corr, is an MPH student in the Applied Epidemiology concentration. She's graduating in December 2023. Her undergraduate degree is in global health from Arizona State University, where she had the opportunity to explore the field of epidemiology through curriculum and a number of internship experiences. Currently, she works in ophthalmic-related clinical research, where she assists in conducting clinical trials. In the field of public health, she has a strong dedication to maternal and child health, epidemiology, and biostatistics, which motivate her work. After graduation, she hopes to apply this knowledge and skills that she's gained through the program to contribute to the betterment of maternal and child health outcomes. Welcome, Megan. Our second guest speaker today is Carly Erickson. She's an MPH student in the Health Behavior Health Promotion concentration, also graduating in December. She received her bachelor's degree in physiology from the University of Arizona in 2005. She lives in joyful chaos outside of Salt Lake City, Utah, with her husband of 18 years and 4 children ages 6 to 15, a mini golden doodle, plus any varying number of nieces, nephews, and kids, friends in the house and yard at any given time. Carly's APE took place at Center for Change, which is a leading eating disorder treatment center for women and girls. Her interests in public health include chronic illness, mental health, particularly in adolescents, and supporting and educating the village around those who are struggling, so families and communities are stronger and healthier together. After graduation, Carly plans to keep a close relationship with the Center for Change. She'll continue her work as part of a coalition on eating disorders and mental health care access for A Bolder Way Forward, which is a statewide Utah initiative to reduce inequities women and girls face across several areas of life. So welcome to both of you. We're so excited to have you. And so we'll start today's session by having each of you just take a couple of minutes to briefly describe your applied practice experience, so where it was, the basics of what you did. I would like the audience to keep in mind that their full presentations are available on the website for you to watch, so this is not meant to be a duplicative session to that, but we do want to have both Megan and Carly introducing and kind of set us up for what your experiences were. So if Megan, you want to go first and let us know, and then Carly, you follow, that would be great.
Yeah, of course. So my internship experience, it was with a collaboration with Arizona State University School of Social Work, Banner University Medical Center, and the University of Arizona. It was a study with the newborn attachment and wellness study. What I did was a qualitative analysis that was supported by a literature review, but the qualitative data include transcribed interviews from 50 mothers who were addicted to or treated with opioids while they were pregnant and who had recently given birth. And pretty much what I did was I coded these interviews by major themes or factors or experiences that sort of help to explain the relationship between breastfeeding intentions, initiation, and outcome among these participants.
Fantastic. Thank you, Megan. And Carly, a brief description of your project.
Yes, my project took place at Center for Change, which is an eating disorder treatment center here in Utah. When it opened in 1994, it was only the third eating disorder center in the country. And it was the first one outside of the LA area. So what I did is I went in and was actually able to interact with all different levels of the ecological model. I was the first public health person they've ever had in their program. So I worked with the families and patients as part of their Family Education Days program. And I also helped my preceptor, who's the CEO of Center for Change and their head clinician. I did research on social media interaction with eating disorders, and she would use that to advise the governor and then to work on some national litigation that Center for Change has been involved in. And I also created some issue briefs to help with the community level for pediatricians and dentists, and some community information on causes and prevention for eating disorders.
Fantastic. One of my favorite things about these sessions that we have, these live events, is seeing incredibly different projects and how they're all public health related. So I used to play this game with students where it was like 6 degrees of public health, right? Tell me anything and I can find a way to connect it to public health. And the truth is, both of you in your presentations, which were lovely, everybody make sure you go and watch them, talked about really how you're making connections, right? Social work to public health. Megan, you talked a lot about that. And Carly, you're saying eating disorders have been treated so clinically, but we really have to look at the whole picture, which is very public health. And so I love that your projects are so vastly different in terms of their content area, but really not in terms of impact on the communities, right? They're both going to impact communities. So that's really amazing to see. I love it. So a very practical question. How did you find your APA experience? And either of you can jump in and answer, or I can call your names, whichever you prefer.
Whatever's easiest, I can go first.
Yeah, great.
I did have some experience with Center for Change where I attended their family program initially about 6 years ago with a family member who was being treated there. And I absolutely loved everything. I wish every chronic illness had like family education. I've had chronic migraines for a long time, and I wish someone would like teach my husband and kids what that means, not when I'm in the middle of a headache. And I'm like, no, I just hate everyone right now. So I really loved the program. So I just reached out to some of the staff and just kept going until I got a hold of the CEO and she was interested. So obviously I didn't ask to be born in the perfect demographic for a Karen, but here I am. So I'll just keep asking to speak to the manager, and kind of presented some of the things that I would like to do to help enhance their program that helped me so much. And she brought me in and agreed to work with me and be my preceptor. So
persistence pays off. I like it. It's sort of the cold call, right? A cold email, but you continue until it's hot and you get what you want, which is fantastic. How about you, Megan?
Yeah, so I found my internship through the University of Arizona's hub, where you guys kind of post. I know Samantha, she's constantly posting stuff on there about like new internship opportunities and whatnot. So I was kind of on the lookout for something related to maternal and child health, because that's what I wanted to do. And I came across this internship, and so I applied. And I sort of met with my preceptor and told her sort of what my interests were. Her study in particular wasn't like exactly related to breastfeeding, but I knew that I also wanted to do something with breastfeeding. So we kind of worked out how I could, make my project work with her data and whatnot. And we just moved forward from there.
So without planning this, because we didn't, those are the two perfect examples of the really, I think, the most common ways our students are finding experiences. Either they've had experience with an organization and then they sort of find their niche like Carly did, or they start with the hub. But I think that's a beautiful experience, Megan, of how you were able to combine your interests. And I find that preceptors are often very amenable to that. Sometimes projects are fixed and that's okay too, but it's really nice when you can say, well, it's like that negotiation portion. How can we both get the most out of this? And that's really incredible. So thank you both for fitting into the exact model of how students are normally finding experiences. So some of these questions we don't know the answers to, so we can be surprised as well. Do you feel that your experiences were, or I'm sorry, can you describe any unique experiences you felt like you had during your APE? Unique, that could mean good, it could mean bad. Surprising experiences. And Megan, if you want to.
Yeah, I'll jump in. So just like with my experience in general, I feel like it really included a wide range of unique experiences. Related to qualitative research in general. It's not something I was used to. I've never done it before, but it's also working with a vulnerable and complex population. And the internship also kind of forced me to take like an interdisciplinary approach, I suppose, and something that like I wasn't used to, and definitely like took me out of my comfort zone. But I definitely thought it was really rewarding, and it broadened my understanding of the complexities that are involved in addressing the needs of mothers with opioid use disorder or who have received medication for opioid use disorder during pregnancies.
That's great. I think it's really powerful when students have experiences that are new for them. I think it's easy to sort of navigate or gravitate, towards experiences that feel familiar. I think taking yourself outside of that box means everything's unique and special and new in that experience, which is really incredible for both you and your resume, right? To be able to do something that you don't already have the skills in is pretty fantastic. How about you, Carly?
Well, I would say that some of my internship changed a little bit, and we did have a lot of unique experiences. Just the timing worked out really well. A lot of people have been working in eating disorders, working in youth mental health for years, trying to move the needle on some things, and I just happened to be here when things started really happening, which was very lucky. Initially, I was going to do social media and eating disorder literature review for a national speech with my preceptor was going to give, and I really was in my first conference meeting with Dr. Gerard. My preceptor's like, okay, flag on that. The governor needs me to advise him on this, so it's going to be for the governor. And then being able to get involved with the multi-district litigation that's been going on with social media companies, I was able to be introduced to the lawyers there. And some of those cases had, rulings that just came down in October, allowing those cases to proceed to get some of the discovery of what those algorithms are doing when they're showing pro-eating disorder content to youth and things. Like, those are things people have been fighting for forever, and they just happened to all happen in this like 4 months last 4 months I was on the site. So it was really, really cool. I think I might have gotten a little bit of a rosier picture of how things change than is perhaps accurate for public health, just because of my timing, but it really was unique to just be able to see changes on all these levels that you wouldn't normally have access to. So.
Magical timing indeed, right? You did not expect to be doing work for the governor and work for litigation, and yet here you are. And I think, though, you made the point that is maybe a rosier picture of how it felt like things moved really quickly, because in your world they did. But I think as long as you recognize and you did already, how long people had been working on these things for years and years and years. And you just happened to be there at that magical point to sort of see it come together a little bit, which is fantastic, because I think it can give students, yourself, other students, hope that some of the work they're doing now, while it might not feel meaningful because it's the early stages, to know that down the road magic happens from all the work. I mean, it's really the result of that hard work. That's pretty great. So we really like to see that. So I know in your presentations, both of you talked about contributions to public health and the need for sort of more interdisciplinary work when it comes to public health, social work, or clinicians. So what would you say your applied practice experience, how would you say the work that you did is going to contribute to the field of public health? And we'll start with you, Carly.
Well, I feel like when it comes to youth mental health, there's been a lot happening lately. The Surgeon General just released a national advisory on some of the things that youth are facing. So I feel like public health really is going to be at the vanguard of helping bring all of those issues together. So to be able to kind of see what's been going on over here with the therapy, and over here with the clinical, and over here with dietary when it comes to eating disorders, having it all in one center, how like that's kind of the gold standard for treatment, is to have a team. But I really feel like public health has a part of that team in connecting it to the wider network. And how does this actually fit into what's trending, across the country? How do we bring in more, we're working on bringing in more men and boys because those rates are rising and making up a bigger percentage than ever before. So all of those things public health really has a role in, because they play a role in the legislation, all that stuff that's required to make that happen.
Yeah, so there's the holistically treating the individual, which is powerful and sort of standard. But then there's holistically treating the community. And how do you do that? And how do you bring that bigger picture in? And making sure that the individuals who are getting access to care are all of the individuals who might need care. I know you mentioned it's primarily women and girls, but like you said, we're bringing young men and boys into the situation. How might things look different or similar? And then when you're moving up that policy structure, right? So we're getting bigger and bigger. And that's public health, but it's hard, it's big work, it's hard work. And so I think you were right about that magic time of seeing that individual to community piece, I think. And then Megan, how about you? How do you see the work you did?
Well, I think it's really relevant to public health and addressing a lot of maternal and child health issues. I also think a focus on this type of research is really important to the development of different policies or interventions to improve breastfeeding outcomes, but especially breastfeeding outcomes among mothers who used or were treated with opioids during pregnancy, especially when you start to consider all of the health benefits of breastfeeding, not just in the general population, but also specifically in mothers with opioid use disorder and infants who, might be experiencing symptoms of withdrawal. So it just kind of, it offers ways that this type of research can contribute to more effective public health interventions.
What I really found interesting in your presentation is that it's qualitative research, which I really like, because there's all the numbers out there about initiation rates and persistence rates. Yeah. But what I found really interesting with your project is you talked about the birth experience and how women with opioid use disorder might have a very different birth experience because of how they're treated by their providers, and how that influences breastfeeding rates, and then also the social dynamic that they have in their worlds, and how that influences. So really it's all of those factors. Carly, you used the ecological model, and I'm like, oh, we could take that and layer it right onto Megan's project, right? And all of the different spheres of influence. But I thought it was really powerful. I really liked the qualitative, your graphics and the qualitative component of your research, because I think it's really easy to see numbers and you forget that they're people and their stories.
Exactly.
Yeah, so that was really, really great. What are you both most excited about doing with this work?
I would say the most exciting thing for me, it kind of dovetails with like my favorite thing, which is helping the family education and helping empower family members when they're facing something There's a lot of stigma around eating disorders. There's a lot of blame for family members that doesn't need to be there. There's a huge biological and genetic component to these disorders that they don't know about. So when they come in for like family education, they just really go from really timid, worrying, are they going to say it's all my fault when I walk in there? Maybe they haven't seen their loved one in a while because they've been in treatment, to the confidence that they have that like, okay, I do start to understand what they're going through. And I do feel like I've got a handle on what these disorders are. It's just really beautiful to see. And I really do enjoy continuing that educational work, because you can almost, for family days is 2 days long, but you can almost watch people just go from deer in headlights, which is the look I had when I first showed up at Center for Change, to just like confident and a little more relaxed and more hopeful, and they don't feel as alone when they're able to connect with other organizations and people who are dealing with the same thing.
Right, that's so fundamental, right? That sense of community and how you approach many health issues, but in particular, if you're working with somebody who's been away at treatment, how you help that social environment. And then Megan, what about you? Something you're really excited about, or your favorite thing about your experience?
I think my favorite part about my experience was the qualitative aspect of it. I'm so used to seeing the numbers, and I've seen all of the data, like quantitative data. I've already seen that. And so like taking this step to do a qualitative analysis was very different for me, and it really opened my eyes. I feel like it gave me a heightened sense of empathy and sensitivity to this population. And I feel like as like a epidemiologist moving forward, hopefully like I can take what I've learned like here and sort of apply like a commitment to destigmatization in my career moving forward, and hopefully make a difference.
I love it. I love the excitement I see on your face when you explain that. I also like the excitement when you said, as an epidemiologist, you sort of owned that for a minute. That was really great. So the next question is sort of maybe a more pragmatic or more practical question that we certainly love to hear. I know the faculty love to hear these answers as well, or generally do, depending on the answer. But what would you say from your MPH program, what would you say a class or curriculum was really beneficial for you to have had going into your experience? Like what was something that you're really glad you took class XYZ before your experience? And we'll start with you, Megan.
Well, I believe it was with Dr. Gerard. It was on sociocultural and behavioral health. I feel like that really equipped me for a good foundation to be able to comprehend and address the different complexities of my internship, especially knowing the behavioral health concepts for analyzing behavioral aspects that are involved in breastfeeding, like self-efficacy and decision-making processes, and how those sort of interacted with sociocultural factors.
That's great. I think everybody, me included, would have thought maybe she's going to say epi or biostats. But I really, hearing that, it's, that's really important, is to recognize that the core courses in public health all feed into projects in different and sometimes unexpected ways in the knowledge that you need. That's great. What about you, Carly?
I would say, as much as I did not appreciate them at the time, all the evaluation reports that I had to do in my program worked really well, and I had to do a curriculum evaluation. They were not my favorite homework, but they were probably the most useful for being able to say, here's the data on this program, here's what we need moving forward, and being able to send that into like the corporate partnerships that we can, maybe expand some budget things. So that's probably the most helpful. And also the multicultural and sociocultural aspects of health that we did. Dr. Gerard, Dr. BT, I was able to do some of the homework for Dr. BT's class on site, separate from my internship, and we were able to implement some of those things to help LGBTQ plus youth who have higher rates of eating disorders and higher suicidality within those disorders. And so it was really great to be able to kind of say, this is how we can be more sensitive and be more helpful to some of these cultural groups that haven't traditionally been tied with eating disorders, but they do experience them, and it maybe appears in a little different way.
Oh, the real time, getting to do the real time class and real life work, that's extra meaningful, right? I do love, and I'm sure the faculty love, when you say things like, I did not like the assignments, but they were very useful.
Sure.
And for students, prospective students in the room, or students who are in progress with the MPH, take note of that, because sometimes those really difficult, frustrating things that you aren't sure how they'll be valuable, or you just are really struggling with them, might end up being the cornerstone to be able to do a project and to see things in real time. So MPH lesson there. So I'd love to open it to the audience for questions. We'll take a pause. I do have some additional questions if the audience doesn't, but I'd love to take a moment to see. We've got a good number. I saw faculty, I saw incoming MPH students, current MPH students. Do any of you have questions for Megan or Carly about their projects? You can use the chat, you can raise your hand.
So Kim, I actually received a question via email. I'm gonna put it in the chat, and I believe it's from a faculty member. So the students talked about an interdisciplinary approach to public health. My question to them is, how does this type of approach used in the curriculum the students have taken in the college, how does this type of approach used in the curriculum that the students have taken within the College of Public Health? And if not, how can we as faculty, or what can we do to provide interdisciplinary thinking? We as faculty often tend to focus on our own discipline. Sorry, a few things happened here as I was reading that question, so I apologize for the pause there.
Yeah, no, that makes sense. Yeah, I saw there were a couple pop-ups. So basically, like how from your perspectives as students who went on to do very interdisciplinary work in your internships, feel it could be more embedded in the curriculum? And you may not have an answer to that, but we'd love to hear it if you do from your perspective.
I felt like the IPE experiences that we did with part of our program were really quite helpful for the interdisciplinary approach, and having to work with that. In class, we didn't do it as much, but I still feel like my classmates kind of had different interests and areas of interest that tend to overlap a little bit. A lot of our classmates, like I'm on a team right now where like we have a surgeon on our team, and we have like another doctor, and then we have like brand new grad students who are going straight from their bachelor's. And so there is kind of a different approach and perspective. So I do think we get a little bit of that, but that interdisciplinary approach is pretty helpful.
Yeah, I'd also say it's also in the core classes that you take. I know it's all still public health, but you're like with other people of different concentrations and whatnot, so you're getting different perspectives and stuff too. But other than that, I mean, I know the IPE, that was a really fun experience. So I would say those two things.
So I'm hearing both IPE, which again, yay for that being a requirement, because I think many students wouldn't take advantage of that, but also that group work dynamic. So as much as sometimes group work challenges us, we also have an opportunity to really learn from one another, especially if folks are coming from different fields or have very different perspectives on an issue or different undergraduate degrees, to really have some conversations and learn from one another about how they would approach a problem or a public health issue. So again, sometimes the things we don't like, maybe you're a fan of group work, maybe you're not. I hear both sides of that coin, right? There's value to be had from learning from one another for sure. So that's great. Other questions that folks have? Yes, Dr. Jacobs.
Both of these projects sound amazing, and I'm going to be honest and say I've only gotten through, the EPI in-person presentation so far. So Megan, I'm sorry, I have not yet watched yours nor Carly's. So my question is coming from a place of ignorance. And so Carly, could you share a little bit more about the algorithm lawsuits? I'm really fascinated by that because I'm interested in the overarching theme of misinformation overall, which is slightly different, but Can you share a little bit more about that?
Well, I could talk about all day, so it really depends on what you want to know.
Well, congratulations, you've officially graduated then. But go ahead.
What's been officially going on is there's currently multi-district litigation that is being concentrated in LA, and that is a coalition of families and school districts that have been affected by eating disorder content that has been promoted to adolescents on social media platforms, but specifically on Instagram and TikTok. So what happened was on October 13th, the judge in that case dismissed the motion to dismiss from the social media companies based on previously all those cases have been dismissed based on First Amendment grounds, freedom of speech. But the judge on October 13th dismissed that, saying you can't claim to just be the platform hosting if you're actually targeting people with content. You are now part of the pipeline, and the case is proceeding to discovery. So unless the social media companies settle, they will have to open up all of their algorithms for those lawyers to go through in discovery. And then it was the week after that that 33 attorney generals representing different states jumped in with the lawsuits. I think the legal experts were waiting for the judge in this case to make a decision. And in theory, all of that discovery is going to become available to lawyers, hopefully shortly. So.
I'm glad to hear that. I think that social media is a major public health problem right now, and I did notice that there's a town in the UK or Ireland that has now banned cell phones for kids under the age of 12 or something, and I was like, that's maybe something that I would have been interested in as a parent. So that's really interesting. And then Megan, I noticed you mentioned in passing that your work had led to you having more empathy towards individuals who are struggling with substance abuse disorder. And I really appreciated that, because just this morning I was in another session about implicit biases that we carry, all of us, towards individuals. So I was wondering if you wouldn't mind expanding on that just a tiny bit more to tell us how that affected you and changed your way of thinking.
Yeah, so going in again, like I've seen the numbers and I know the numbers, but I didn't know the experiences. So I didn't know how these women were being treated, and like hearing their perspective on things. I think the most eye-opening part was their birth experience. A lot of them would talk about how they were treated by medical professionals who maybe didn't know best practices, or who maybe didn't know their situation, or how to treat them like properly, which is crazy. So I think that experience for me was so eye-opening, because I now know like how I want to like approach different situations, especially like public health interventions and whatnot, that can help reduce that stigma, and how to implement like the best practices, I guess, for especially healthcare providers where necessary.
Thank you so much. You both did a wonderful job, and thank you for being here to share this with us.
Thank you.
Thank you.
Fantastic. And again, this is a great moment. Thank you, Dr. Jacobs, to make sure everyone knows to go and watch these two presentations later, but there's also a huge number of presentations. If you want to see breadth in projects, all of our concentrations that have presenters this fall, albeit it's a shorter list than we'll see in May and August, but it's really, really great to see all the different types of projects out there. So I definitely invite you to, after this session, check those out. Everybody did such an amazing job on their presentation. Are there other questions from the audience? Well, while you all are thinking, I do have another question, which is, what is a piece of advice you would give a fellow MPH student or a new MPH student about planning their applied practice experience? Planning or conducting, sort of a lessons learned in the process.
I'd say just like from my experience of like finding an internship, I would say probably reaching out to multiple sites and people who are looking for students in particular. I think that makes the process a lot easier when they are looking for students. You can always like, I know Carly, she was mentioning how she, just was persistent and really said, what she wanted to do. But I found it really helpful that a lot of these people were looking for students and they were open to hearing my ideas and all of that. So that would be my piece of advice, and to use like the U of A hub and the resources that there are there to find those internships.
That's great. Carly.
I would say just to find something that you care about. Presumably you're going to this program because you care a lot about certain elements of public health, and then to be confident in sharing what you think you can bring to the table and what skills you have that will help their site. Having a relationship with the site kind of before I went there helped. And honestly, I was honest with them that this was kind of a way for me to give back, that they saved the life of somebody that I loved. But I did have these skills that I could bring to the table. And, things are hard in healthcare post-COVID. There's a lot, especially mental health care. There's a lot of people who are really burned out, who've been working really, really hard. So having someone who's like new, but still excited and ready to jump in really does go a long way. And all of the staff was just so excited and so grateful that for anything that I was able to help them with. And really, I just think going in there and being confident and having new energy helps.
You bring up a point that I really hadn't thought about, which is that burnout aspect, right? So folks really aren't tired. And so to bring not only your labor and your skilled labor, but also your excitement, I think can really help invigorate or reinvigorate folks who are doing the work. And so I think that's a really powerful perspective to share with students, to say, don't forget, you have things to bring to the table. And Megan, you mentioned that you sort of negotiated in some of the breastfeeding aspects. And I think there's a powerful lesson there, which is that don't forget that you're supposed to be doing something beneficial for an agency, but you're also supposed to be getting something great out of it. And if they hadn't thought about the breastfeeding aspect before, that's new energy that you're bringing to their research as well, and potentially new avenues for them to study. So again, reinvigorating in some cases the work that's being done into new directions, I think is a really powerful way to think about yourselves as assets to the team, and not just as someone who's there to learn something, right? We're there to give back to the organizations. So we do have a question in the chat. Dr. Kutchas asks, are there any skills you wished you had as you approached your APE that could be better addressed in the curriculum? Oh, this is one of those like end of semester questions, right? You got to give the real feedback here.
I guess sorry, go ahead.
I would say, any increase to kind of the interdisciplinary stuff that we kind of already addressed, like those IPs were really helpful. And really just kind of communication and building those networks with classmates helps. Because I was the only public health person to ever work there, my professors and my classmates really became my colleagues when I would hit snags and be like, how should I approach this public health wise? Because it was just me. So building those relationships really was helpful, even though I'm an online student and we weren't meeting face to face. There were plenty of times I was messaging former classmates and kind of asking their approach on things.
I'd love to hear that you built a community. I think that's really what we hope students are going to do at all levels. That's really great. Megan, you were going to say something.
I guess for me, it would have been maybe just a little bit more information on qualitative research. I did feel like a bit of a fish out of water when I first started. So just like learning more about how to do it and what it is and why it's relevant would be helpful. Yeah, it's also kind of, I feel like qualitative research, at least like the like process of like coding and how people do it, can be kind of almost secretive sometimes. I feel like not everyone all this stuff, so it's hard to find like videos and resources to tell you step by step what to do. So I would say maybe something like that.
definitely the creative part of qualitative analysis, right? You have to sort of really think through, okay, what am I going to ask? And then how am I going to present this? How do I make it impactful on the other end versus just giving like scripted answers, right? Like I saw for you, you did themes and you had sort of a nice map of what those looked like. And so that's really, it's really great. But yeah, that can be tough to find. And sometimes even for the sequencing in our programs, it might be something you've learned, but sort of when you're already in the experience too, which can be a little bit tricky sometimes with the sequencing. So another great question in the chat is, do you have any tips on balancing the internship, the applied experience, with life, work, classes, family, how you manage that? And we'll start with Megan.
Well, I was really lucky. My work, they have been like so flexible with me, and I've just kind of like told them like what I'm doing right now, and they've been able to help work with me and my schedule and whatnot. So I guess sort of being honest about like where you're at and what you need from, your work or your family or whoever it might be, and just asking for help.
I think it's also really important to factor that into the internship plan, right? Your timeline, and really thinking strategically about what is manageable for you in that timeline. So the pacing is well done for yourself. Carly, I know you mentioned there was some incentivizing happening in your house. So how were you able to balance life, work, classes, internship?
Well, one of the things that I do, since I do have 4 kids, is we kind of bring them along. If someone in our family is interested in something, then we all kind of learn about it a little bit. So in a lot of ways, I kind of drag them along this experience with me. And I'm like, especially because a lot of what I'm learning and working with overlaps with their interests. Social media, I have a 15-year-old daughter. I am very popular with their parents now, not so much with her friends, because I research it and I talk about it. So, for balancing that, part of it is helping my family understand why I'm doing the work that I'm doing, and what we can take away that we can kind of incorporate and learn, and just making sure that we all kind of are supportive of why. And then sometimes it's okay, I will bribe you to give me an hour of quiet.
Yes, very important. And I can imagine, I had the conversation with my 12-year-old this morning, a reminder that while you have a phone, there's no social media allowed on your phone. Just a reminder. And this is what I know social media to be. And I listed a few things, and then I stopped and said, wait, are there other things I'm forgetting? Which of course you can't ask the 12-year-old that, because they'll never tell you. So yes, I can imagine that there's conversations happening, but I do like the idea of how can I incorporate this into my life, as opposed to sort of life being in conflict all the time. Although that's not always possible with different projects and different scenarios.
Depends on your project and depends on how technical it is, but mine worked well for that. So
I'm glad that you found that balance. That's a really important one. Other questions? Thank you for the audience engagement. Other questions? So the last question I have for you is, what is the last sort of parting information about your internship experience that you'd like us all to have? That's sort of like 1-minute elevator speech closing from your project that's sort of powerful, something the most powerful for you. Carly? And we can give it a second to think too. You need to think about that. That's a big question.
I would say that for me, it was really a matter of just diving right in and getting involved, and really I was lucky because it had been a while since I was back in school. So I really did enjoy the ride a lot more than I did kind of when I was younger, and I was just like checking boxes. So really to just enjoy that and enjoy noticing the work that's being done around you and the contributions of the entire interdisciplinary team. It really did kind of help restore some of that tiredness from all like the coursework. Like after a while, you're like, why am I still doing this? The internship was really what helped me go, yeah, this is exactly why I'm doing this, because this is what people are accomplishing and this is the difference that's being made. And take the time to notice those things and let them kind of fill you up. Your internship can really just be a really wonderful kind of changing experience.
That's really, really great. Thank you so much for that perspective. I think it's a good reminder to anybody approaching school or something new, which is to sort of really see the value and see how how it adds to your life versus how it takes away sometimes. Megan, what would you share?
I would say that make sure you plan ahead of time. I think that especially when it comes to the IRB, there's a lot of like back and forth that goes on there that I just wasn't expecting, even though I work in clinical research. But yeah, I wasn't expecting the back and forth. So just like planning ahead of time and planning for any delays in paperwork, because really you're working on like their timeline, even though they're trying to get things in as fast as possible. But yeah, I would say that. And then just as far as like the internship itself, just sort of be open to new experiences, like learning experiences and whatnot, because I think that will take you a long way.
That's really great advice, both pragmatic in terms of IRB. I was wondering if somebody was going to bring it up, so thank you for sharing that. Yes, sort of the timeliness that it takes to get the project up and running, but then also, you know, being open and being open-minded to your experience that you've designed, but also how things might change, or, you know, you might be learning something new. You might be looking for YouTube videos. You might be talking to the governor, right? Like you never know kind of where it's going to take you. And so being open to that is really important. Any last things you want to share before I pass it to Samantha? We so appreciate you both today. I'm so excited for everybody to go and watch your internships. Make sure, audience, when you do, that you fill out the feedback form, and Mariah's going to give us some information on that a little bit later. But thank you both so much. Everyone, please stick around. Samantha's going to give us a little orientation, a little wrap-up session, orientation to some of the other things, and then we'll follow up with Mariah. So I pass it to you, Samantha.
Awesome. All right. Well, thank you again so much to our presenters, and thank you so much, Kim, for facilitating. My quick debrief here is the discussion of the conference itself. So thank you everyone for attending today, and thank you, Kim, and our presenters for this great discussion. First, we would like to thank all of our wonderful applied practice experience sites throughout the state, nation, and world with whom we work with to improve the state of public health. The Applied Practice Experience Conference serves as a professional opportunity for our Master of Public Health students to share their APEs, Applied Practice Experiences, and has been one of the most impactful and practical components of our program's curriculum. Since its establishment, the MPH Applied Practice Experience Conference has grown in stature and significance, and the college uses this event as a public health networking tool by inviting public health practitioners, partners, and alumni throughout the state. The key to its success lies in the student participation, so thank you everyone, this panel, and all of our presenters. Through contributions they have made and the benefits they have gained, the Applied Practice Experience Conference reflects the undeniable handprint of MESCOV students on public health projects and agencies throughout the world. We sincerely thank you all for coming to our virtual MPH APE Conference Student Highlight event, and for those watching this recording, hi, and thank you for watching. Here's the link to the feedback form for this event, and we're going to put it here in the chat. We would appreciate if you could take a few minutes to complete that form, as it helps us to better this event each time that we have it. Next, I will pass it over to Mariah, who's going to give us more information about the website itself.
Yes, so I'm having a little bit of a connection issue, so I can't turn on my camera, so I apologize for that. But this virtual experience allows us to provide an applied practice experience conference that showcases projects from students across all of our campuses. Each student has recorded themselves presenting on their master's applied practice experience. These presentation recordings are being hosted on a webpage on the College of Public Health website. This page went live earlier this week, and you can now access our fall 2023 presenters presentation recordings. And Sam just put the link in the chat. We have also sent this website link to our College of Public Health community, as well as individually to all presenters for them to share with their family, friends, site preceptors, and anyone else they would like to share it with. Presentations will be viewable in an on-demand format from Monday the 13th until end of the day Friday, December 1st. At that time, the presentation viewing webpage will be deactivated. We encourage you to watch as many presentations as you are able to during the viewing period. For each presentation you watch, we also ask that you fill out the presentation feedback form linked on the presentation viewing webpage. We appreciate your support of the College of Public Health and our MPH students. They have all worked incredibly hard on their applied practice experience projects, and we are excited for you to view their presentations in order to see the ways in which they are helping move public health issues forward in our communities. We've now come to the end of our live event. So we sincerely appreciate you all joining us this afternoon, and thank you to our student panelists, Megan and Carly. You did great. And we hope you enjoy watching the student presentations and have a fantastic rest of your day.